Alright, so welcome to our today's lesson. We are going to be solving questions which are under cardiac output. Okay, so this is an exam question that I have here, and I've got several questions in one question. Okay, so pay attention. It is very simple actually. Yeah, just pay attention. Stick around. Okay, so the question reads: a 70 kg man comes to the hospital and presents to you the results of the parameters he was given on the previous visit. Okay, so in short, this question is saying that you are a doctor and then initially this person visited you, okay, at the hospital. Then you had to measure the end diastolic volume and you found that it was 122 milliliters. Then end systolic volume, you found that it was 51 milliliters. Then now this person again came to you again. Okay, so this is the second time this person is coming to you at the hospital. Okay, and then now it's saying that assess all and find the following. So this person is coming to you as a patient, but you are a doctor, and then he's saying you to say these results that you got, can you please tell me what these are? No wonder the question is saying assess all and find the following. So what are we finding? 1, ejection fraction. 2, ejection volume. 3, heart rate. 4, cardiac output. 5, compare with the normal values. Okay, so this person again is telling you to say, can you please try to compare what you have found to their normal values? Okay, then the last question is saying write the cardiac index. Write the cardiac index. So these are the questions that we have here. And what? Cardiac output. So let us go right into it. So let us solve. Okay. So ejection fraction. So ejection fraction is our first question here. How do we solve? So ejection fraction is given by the stroke volume over the end diastolic volume times the 100%. Okay. So this is the ejection fraction equation that we use. Okay. Very simple. Do we have the stroke volume? Oh, we don't have. Do we have the end diastolic volume? Yes, we do have. It was here. Okay. So meaning we just have to find for stroke volume for us to do what? To continue with the solvings of ejection fraction. It's very simple. All you have to do it is do the subtraction of these two. Okay. So the stroke volume will be equal to the end diastolic volume minus the end systolic volume. If we find the difference here between the end diastolic volume and the end systolic volume, the answer will be the stroke volume. Okay, so mind you, remember that the stroke volume, it is also referred to as what? The ejection volume. Okay, so what we are solving for here, it is what? Ejection from volume, because we know ejection volume, it is also known as the stroke volume. Okay, so this is the formula that we use. So what is the end diastolic volume? So end diastolic volume we are given, it is 122. 122 minus end systolic volume, it is 51. 51. So let us now try to solve together. Let us try to punch. Okay, 122 minus 51. Minus 51, I'm getting 71. So here we are having 71. 71 what? Because you have to put units here. Okay, you are a doctor. 71 milliliters. So milliliter. So this is the ejection volume or the stroke volume. It is given in milliliters. Okay, we have solved for stroke volume. So let us also put these parameters that we have solved here. Okay, there we're going to say the stroke volume is equal to 71 milliliters. Okay, so now since we have the stroke volume, meaning we can again go back to this formula for ejection fraction and put it there and solve for what? Ejection fraction. Very simple. So the ejection fraction will now be equal to, so ejection fraction will now be equal to the stroke volume, which is 71 over the end diastolic volume. What is our end diastolic volume? We were given in the question, it was 122. 122 multiplied by 100%. Okay, so the percentage that we're going to find here will be our ejection fraction. So it is 71 divided by 122 times 100%. I'm getting 58. So here we are getting 58%. Okay, so this is our ejection fraction now. Okay, 58%. So let us put it here. Ejection fraction, we have solved, it is what? 58%. 58%. Very simple. Okay, so if you want You can also do 71 times this. We are getting this 58 over 100, or you can leave this your answer into a fraction form. Okay, so ejection fraction we have solved is what? 58%. So let us stick here. We have solved for ejection fraction. What of ejection volume? So let us now try to solve the second question. But remember, let us go back to these solvings that we are doing here. I said ejection volume, it is also referred to as what? Stroke volume. Okay, so meaning we have also solved for ejection volume. Have you seen? Very simple. So let us now go to the third question. Third question is saying find the heart rate. Okay, so here we are solving for heart rate. So let us try to use this same space here. Okay, so the heart rate is given by, so we are going to use the standard formula. So heart rate will be given by, or maybe let me just show you where this formula is coming from. We are saying cardiac output. Okay, so this is the cardiac output will be equal to the heart rate multiplied by the stroke volume. Okay, so this is multiplication multiplied by the stroke volume. So this is a formula that we use to calculate for what? Cardiac output. But we have the heart rate in this formula. So meaning making the heart rate the subject, it means we are going to be solving for what? Heart rate. Okay, provided we have these, the value for stroke volume and the value for cardiac output. So let us try to make the heart rate the subject of the formula. So it is going to be over the stroke volume, even here over the stroke volume. So this we are going to divide, then we're going to say heart rate will now be equal to cardiac output divided by the stroke volume. Okay, so this is now the formula that we have. So this is the formula that we're going to use now to calculate for what? For heart rate. Okay, remember heart rate is given in beats per minute. Beats per minute. Okay, so what we're going to do here is, have we been given the cardiac output? No. So meaning here, we're going to use the standard cardiac output, okay, for an average 70 kg old man. Okay, so you have to be taking note of everything that we've been given in this formula. Okay, so heart rate, it is given by cardiac output over stroke volume. So the standard cardiac output is 5 liters. So cardiac output, so here heart rate will be equal to 5 liters, because we know 5 liters, it is the standard for the average person. It is 5 liters. Okay, over the stroke volume. The stroke volume we have here, we solved for stroke volume, it is 71 milliliters. So here we are solving for heart rate in what? In beats per minute. Beats per minute. Okay, so this is the heart rate that we are solving. But remember here, we have these, they are having different units. So what are we going to do there? Okay, very simple. We're just going to apply some mathematics. Okay, yeah. So we're going to say, if we want, we can convert this into liters. So it will be 71 divided by 1000, and the answer that we're going to get will be in liters now. So 71 divided by 1000, we are getting 0.071. So here the answer is 0.071 liters now. Okay, so this is the answer that we're going to use here. This one, 0.071 in liters. So that now we do what? We solve. Okay, so the heart rate will now be equal to 5 liters over the 0.071, which is here in liters. So if we solve for this, what are we getting? 5 divided by 0.071, I'm getting 70. Okay, so the heart rate here, let me write it here. So the heart rate will be equal to, if we divide these, the answer we are getting, it is 70.4222. Yeah, so running it off will be equal to 70. So heart rate will be equal to 70 beats per minute. Okay, so this is our heart rate, 70 beats per minute. We have solved for heart rate. Very simple. Okay, so heart rate here, we are putting it here. Heart rate will be equal to 70 beats per minute. Okay, that is our heart rate. So let us now go to the other question, the fourth question. So the fourth question is telling us to say, calculate for cardiac output. So here we are solving for cardiac output. Okay. So cardiac output, it is also very simple and very easy. Okay. So what I'm going to do here to calculate for cardiac output, this question 4, we said cardiac output is given by the heart rate multiplied by the stroke volume. Okay, so this is the value that we use to solve for what? Cardiac output. Heart rate multiplied by the stroke volume. Do we have the heart rate? Yes, we solved for it. It is what? 70 beats per minute. But do we have the stroke volume? Yes, the stroke volume we have. It is 71 milliliters. So meaning even this one, easy peasy. We're going to solve it. Okay. So the cardiac output will now be equal to the heart rate. What is our heart rate? 70 beats per minute. So we write 70 beats per minute. Then what is our stroke volume? So the stroke volume we have, it is 71 milliliters. Okay, 71 milliliters. Okay, so now if we multiply this, the answer that we're going to find will be our cardiac output. Let us try to multiply it. 70 times 71, what are we getting? We're getting 4,970. Those are meals now. Okay, meals per minute. Okay, those are meals per minute because this is beats per minute. That is our cardiac output. But for us not to be confused, here where we have put 71 milliliters, let us put what? 0.07 liters, because it will be very easy for us to read the cardiac output because it is given in what? In liters. Okay, so here where we are having stroke volume of 71 milliliters, we are just going to convert this 71 milliliters into the liters. Okay, so now we have the value there. So we are replacing this with that, which is 0.071 liters. Okay, so here we are putting 0.071 liters now. Okay, so now let us try to punch this so that our answer will be in liters, not in milliliters. So if we punch that 70 times 0.071, I'm getting 4.97. Okay, so the cardiac output will now be equal to 4.97. Of course, if we run this off, we are going to have just a 5 watt. Okay, so this is our cardiac output. So the cardiac output will now be the liters. So this is 5 liters. Okay, of course per minute. Okay, this is 5 liters per minute. That is our cardiac output. Very simple. So we have solved for cardiac output. Okay, so what other question are remaining here? So we have, so now the fifth question is saying that compare with normal values. Okay, so let's put this answer there. Our cardiac output, we are saying it is equal to 5 liters. Okay, 5 liters per minute. That is our cardiac output. So per minute, 5 liters. So now let us compare to the what? To the normal ranges or normal values of these. What is the normal value of the stroke volume? Okay, what is the normal value for the stroke volume? Or we can start with ejection fraction. We can start with heart rate. We can start with any. Okay, very simple. We're starting with heart rate. Okay, so the heart rate, the normal range for heart rate is 60 beats per minute to 100 beats per minute. Okay, so now you are interpreting this to this 70 kg man. You are telling the result. So what we are solving here, we are telling this person as, so we are solving this as a doctor. Okay, yeah. So 60 beats per minute to 100 beats per minute. Okay, yeah, beats per minute. This is the normal range for the heart rate. So now comparing the heart rate that we found to the normal range, is it falling within the normal range? We found 70 beats per minute. Yes, it is falling within the range. Okay, meaning the heart rate is just okay. His heart rate is just okay. What of the ejection fraction? Okay, so now the ejection fraction, what is now the normal range for the ejection fraction? Okay, so the ejection fraction, the normal range is from 55, this is now in percentage, so 55% to about close to 70. Okay, 70%. This is the normal range for what? For ejection fraction. 55% at least to 70%. Yeah, ejection fraction. Now let us try to compare again. The ejection fraction that we found, so the ejection fraction for this man to the normal range, is it falling within the normal range? Yes, it is, because it is 58. So it is just okay. Okay. So now let us also try to compare this one. Okay, the stroke volume. So the stroke volume, the normal range is from at least 65 milliliters, okay, to about 70. Okay, this is stroke volume. Okay, so to about 75. Yeah. So depending on the book that you're using. So here, different ranges can be given. Yeah. Okay. So some books say to about 70. Some books say to about 80%. Okay, for stroke volume. 80%, 65 to 80%. Yeah, depending on the book that you're using. Even these values, they can vary within their parameters. Yeah, within their ranges, depending on the book that you're using. So now we have compared everything here that we have. Okay, what are we having next? What are we comparing? The cardiac output. Okay, so the cardiac output, because we solved for it. So the cardiac output, the normal range for cardiac output is from 4 liters, 4 liters that is per minute to about 8 liters. Okay, 8 liters. So this is in liters per minute. So this is the average. This is the average range, okay, for cardiac output. So if it is falling within the range, then it is of course normal. What was our average? What was our cardiac output rather? So it was 5 liters. So we found 5 liters to be our cardiac output. And can we try to compare this to the normal range? Is it falling within the range? It is there. Yes, it is falling within the range. Okay, so it is normal. So we have solved for this. We have compared the normal ranges to the values that we have calculated for this man, and we have told you to say everything that we have solved, they are falling within the range. Okay, so now let us also try to compare also these what we calculated at first initially to their normal values, the end diastolic volume and the end systolic volume, because we have to know even their normal ranges. Okay, so here we are done. So let us now first try to compare the end diastolic volume and the end systolic volume to their normal ranges. Are they falling within the range or they are not? So the end diastolic volume, at least the normal range should be between 65 to about 250. Yeah, to about 250, 260, somewhere there. So this is now in mils. Okay, this is in mils. Some textbook can give you 255 or 245 mils, but it should be within this range. Okay, meaning it is normal. Let us now try to compare what we calculated at first initially. Okay, initially calculated in the static volume to be equal to 122. And what was the normal range, or what is the normal range? It is here. It falling within the range? Yes. So meaning this one, it is correct. Okay, it is okay. It is falling within the range. What of the end systolic volume? What is the normal range for end systolic volume? Okay, so even here, the ranges they can differ depending on the book that you're using. Okay, some textbook they say it is from 16. So end systolic volume, the range, it is at least from 16 to close about, or maybe just 143. Yeah, 143, 145. So this is the range for what? End systolic volume. It should fall within this range. 16 to close about 143. Okay, so this would be the normal range. So let us now try to solve the last question. Okay, the last question that we have here. Yeah. Okay, so now solving the last question. The last question is saying that write the cardiac index. So here we're just writing the cardiac index. So how do we write the cardiac index? So cardiac index. So cardiac index. Cardiac index will be given by this formula where we say cardiac output divided by the body surface area. Okay, so if we divide the cardiac output by the body surface area of that person, what we're going to calculate will be the cardiac index. Okay, very simple. So the cardiac index will now be equal to, so for this man will now be equal to, what is our cardiac output? Cardiac output we solved, it is 5 liters. So 5 liters. What is our body surface area? So the body surface area for a 70 kg man, it is 1.7. Okay, so this is the average. This is the average. But depending on the book, some books they are going to tell you to say the average for a 70 kg man, it is for every man, the average for every man it is 1.9. Then for every woman it is 1.6. So these are the what body surface areas. Yeah. So the women tend to have at least slightly lower body surface area as compared to the what to the man. Yeah. But here we're going to use 1.7. Okay, so that is the average acceptable. Okay, 1.7. But maybe in case maybe you are maybe told to find for that, I'm going to show you at end the formula to calculate for body surface area. But here we're going to use the what the standard, which is 1.7. 1.7. So if we calculate for this, the answer that we are going to get will be our cardiac index. Very simple. So we just multiply, or we just punch that. We divide 5 divided by 1.7. We are getting, so the cardiac index here, we're going to get 2.7, 2.9 rather, 2.941. Yeah, rounding it off, you can even write it off to 3. Okay, so this is our cardiac index. Yeah, we have solved all the questions here. Very simple, very easy peasy. Yeah, so that is our last and final answer, right? The cardiac index. This is the cardiac index.